Thank you for staying with us on News 360. We are still staying on matters of health, and in her 30s, Matilda shares her story with my colleague Akua Oforiwa Darko about her diagnosis of hypertension, also known as high blood pressure, is bringing fears of the unknown into her life. With hypertension cases on the rise, health experts recommend that adhering to hypertensive treatment is key. There's more in the following report.
Being a major contributing factor for heart disease, the burden of hypertension, like any other low and middle income country, has increased significantly in the last decade in Ghana. On average, 1 in 4 adults in Ghana has hypertension. The mother of 3, Matilda, recounts the events leading to her diagnosis of hypertension, that's high blood pressure.
Last week Monday, I said,
I started experiencing dizziness and heart palpitations, so I collapsed and was rushed to the 37 military hospital.
And I see me body course, so I'm so happy. Now my crowd and they say it can happen.
She tells me this is the most dreaded news ever to hear because of the psychological tensions she has been experiencing since she heard about her diagnosis.
Sometimes it's a one watch, I won't treat you. That's my cool simple. Then I'm telling
Now, I barely do nothing and I'm afraid I'll die because I've heard that most people with BP are likely to die.
I caught up with Matilda when she was being prepped to undergo an ECG scan, which is an electrocardiogram, a quick test to check the heartbeat. Matilda's diagnostic medical sonographer, Mildred Frimpong, said she receives cases from the age group between 20 to 40 years who have either been diagnosed with all types of heart-related diseases, especially hypertension.
So when we talk of hypertension, it has to do with the blood being pushed out of the heart, coming under high pressure, and then it tends to narrow the vessels that's the blood is supposed to pass through. When there is too much pressure, the vessels are narrowed, so the blood doesn't feel free to move to where they are supposed to. Because with a stroke, usually we have what we do here, vascular ultrasound, and that is to check the vessels. So usually people with stroke survival, we check the vessels to see if there is any clots.
A pharmacist, Victoria Adams, said with the required treatment with antihypertensive medications and a healthy lifestyle, one's blood pressure will be controlled and hypertension can be well managed.
If you've been diagnosed with any kind of heart disease, I would encourage you to actually comply and take your medications the way you've been advised to take it. I've personally seen patients who had very high blood pressure and they actually complied and took their medications the way they were supposed to. And today their story is very different.
Although Matilda was completely unaware she had extremely high blood pressure, putting her at increased risk of a heart attack or stroke, what she did right was seeking medical attention. Within the few days, she started experiencing symptoms of high blood pressure. For TV3 News, Akua Oforiwa Darko, Akua.